Welcome, Great Hearts families. My name is Kristen Vonberg, and I'm the district nurse for Great Hearts, Texas. I want to thank you for the trust that you've shown in us by sending your students back on campus when we start in-person learning here in a few days. We are eager to have everyone back, as I'm sure you are eager to send them back. I want to assure you that our primary concern over the past few months has been how to create a safe and healthy learning environment for your children. While we can't guarantee a contagion-free environment, our campuses have gone to great lengths to minimize the transmission of COVID-19. We will follow the science and use sound judgment in our response to the pandemic, so things will look and feel a little different this year. Our authoritative source for all of our response and mitigation measures is the Texas Education Agency, or TEA. If there were ever to be more restrictive measures in a particular county that your campus is in, we will follow that guidance as required. So let's start with what may be of concern for many of you, and that is, what happens if a student in my child's class tests positive for COVID-19? We have a detailed step-by-step protocol to respond to positive cases on campus. I won't go into every detail of that protocol, but it is available on our website if you would like to look at it. What's important for you to know is that you will be notified whenever someone in your child's class or section, whether that be a teacher or a student, tests positive for COVID-19. So whenever we are notified of a positive case, a lab confirmed positive, we conduct careful and thorough contact tracing. If your child is determined to be a close contact of that individual, you will be contacted directly by the nurse or a school administrator. Anyone that is determined to have been a close contact will then need to quarantine for 14 days. Now, the school will work with you during this time to either move your student into distance learning or for the duration of the quarantine, or coordinate whatever other contingency your campus has developed. And that'll differ from campus to campus. I just want to reassure you that your student will stay firmly on our radar, and we will do our best to keep them engaged and keep them from falling behind. Now, if you're not notified directly that your child was a close contact of the positive case, then you will receive an email that'll be sent to all of the families who have children in that class. You do not need to take any action. This is just part of our notification policy. The contact tracing that we do to identify the close contacts is very thorough. So if you are not told specifically that your child was a close contact, then you may proceed as normal. Now, while the health and safety of our students is of primary importance, a very close second is their privacy. For that reason, we will not disclose the name of any positive cases in the school. We cannot by law disclose that information. Even if your child is determined to have been a close contact, we will only tell you that they were a close contact. Now, I know this may cause some anxiety or worry on your part. I just ask that you trust us and you trust the process that we have put into place to make sure that everyone stays safe and that their privacy is protected. You can at any time move your student into distance learning, anytime during the quarter. So now you may wonder what to do if your child gets sick. Well, first of all, prior to sending your student to school each morning, we ask that you take your student's temperature. We will not be conducting the routine temperature checks as students arrive. We ask that you do that prior to leaving in the morning. And now I'm going to share my screen and show you the list of symptoms that we're looking for to see if your student is a possible COVID-19 case. So if your student should have any of these symptoms, so the temperature above 100, shaking or exaggerated shivering, loss of taste or smell, cough, shortness of breath, difficulty breathing, sore throat, runny nose or nasal congestion, chills, significant muscle pain, nausea or vomiting, diarrhea, headache or fatigue, We ask that you keep your student home from school if they have any of those symptoms. And if they have those symptoms in a way that is unusual for them, meaning if it's part of a pre-existing condition, such as a cough due to asthma, nasal drainage that's typical of their allergies, well, then that's not a symptom. But these are manifest in a way that is not typical for your child. Now, when you keep them home, we want you to call in your absence to the attendance line or email, however your campus does that. And when you either leave a message or speak to the receptionist, please state what symptoms your child is experiencing and whether or not they are running a fever. The nurse will call you back to gather more information and to discuss whether or not your child's symptoms warrant being quarantined for 10 days. If your child is symptomatic and you would like them to return to school prior to the 10-day quarantine, then you have a couple of options. First of all, you could have them seen by your healthcare provider and receive an alternative diagnosis. For example, they had a sore throat, they go in and they get diagnosed with strep throat. You just bring that in writing from your doctor, and then whenever you've passed the criteria for whatever illness, then you can be readmitted to school. Another option would be to have your child tested for COVID-19. And if you bring the negative test result to school, then you can be readmitted before the 10-day quarantine. So what happens if your child develops symptoms while at school? Your child will let their teacher know that they're not feeling well, and then they'll check the child's temperature with our contactless thermometer, and the teacher will do this or someone in that part of the school will do that. And then if they have a fever or temperature above 100 or any other obvious symptom, they will go directly to our isolation room. We have an isolation area on each campus that's set aside from the nurse's station, and that is where they'll go, and the nurse will come there and assess them immediately. When she assesses them and determines that these symptoms are consistent with or could possibly be COVID-19, she will call the parent, she will call you to pick them up immediately. Of course, if she determines that it isn't consistent with COVID-19, then she would just proceed as she normally would. Now, because this list of symptoms are so broad, we will likely be sending kids home more frequently than we did pre-COVID. So positive and suspected cases of COVID-19 are to stay home for 10 days, and that's 10 days from the onset of symptoms, or in the case of an asymptomatic positive test, 10 days from the positive test. Finally, if your child is exposed to an individual outside of school, for example, a family member or a friend tests positive, we need you to keep your child at home and call and notify the school. Again, the nurse will call you back to get a little bit more information. Your student will need to be quarantined for 14 days from the time of their last known contact with this individual. And the nurse is going to talk to you about that and determine the infectious window and what the soonest your student can return is. Now, I know that the list of symptoms is long, and many of these symptoms are present in illnesses that are not COVID-19, things that we see all the time. But during this period of nationwide pandemic response, we need to be much more stringent in our policy regarding staying home and returning to school. This hopefully will be over soon. It's certainly not going to last forever. Hopefully by next quarter, we will be all back at school and we can relax a little bit and go back to living like it's 2019. While we have tried to think of and plan for every possible scenario, we know that isn't possible. If you still have questions after this town hall, please contact your campus nurse, ask her your questions, and she'll do all she can to help you. We hope you start this year with the confidence in us that we are well prepared to handle the challenge before us. But we also ask for your patience and your grace as we navigate a situation that none of us could have foreseen. Good luck in the new school year and stay safe and healthy.